Hi, my name's Claire. I'm a community mental health nurse with Pennine Care NHS Foundation Trust.
It's 7 a.m. in the morning. I have a pre-work meeting, and that's an interview which I'm doing with my good friend Craig, and that's for our podcast, which is called Retaining the Passion, which is about inspiring and encourage all nurses, but especially those that are newly registered.
Good morning, Craig. How are you?
I'm just laughing. Good morning, Claire. How's your day?
It's about 8 o'clock in the morning, and I've just arrived at the office. I'm on duty today, which means I'm going to be taking calls from lots of patients, doing visits, and possibly going into the clinic to do some medication. The first thing I do is log on and have a look at my emails.
So I've just finished our zoning meeting, which is where we talk about our patients and whether they're at risk or what plans we have for them. We have multidisciplinary team meetings with the consultants on other days.
I spend a huge amount of my day in my car, whether that's driving up to the hospital to do ward rounds, going to see patients face to face, or going to other organisations to have meetings. So right now I'm off to do a visit with a patient. I've just met with one of my patients. We went for a walk. One of the things that they've struggled with, particularly in COVID, is getting out and about. And so we use the opportunity to do both of those things. And I taught them through some techniques for dealing with anxiety. It's important that we make sure that we give as much intervention and support to our patients as they need. And I find doing things like this outside gives us a chance to really practice things that are going to be good for their mental health, as well as getting time to talk to them. So I've just had a phone call that one of my patients has got an issue with their medication. So I'm off to phone the pharmacy and the GP and to go and see if I can resolve that issue. Okay, so I've got the meds and I'm off to deliver them. I've managed to sort it out. Took me a while speaking to the GP and the pharmacist and figuring out what had gone wrong, but we've got them. So I'm off to deliver that to my patient. Okay, as you can see, I'm back in my car. I went back to the office after dropping the meds off and got a phone call from a family member of a patient to say that they'd been unable to contact their patient. So I'm just outside to do a welfare check and see if I can get in touch with them. So I've just been in, I've probably been there for about an hour. I managed to get hold of the patient. Unfortunately, they do seem to have a significant deterioration in their mental health. They haven't been taking prescribed medication and they are becoming acutely unwell. So I'm off to head home. I'm working from home this afternoon and I'm going to try and get in touch with the consultant and formulate a plan. So I'm back home. It's been a really busy morning. In fact, it's now early afternoon and I've just got through the door. It's about 2:45. So before I do anything, I'm going to grab a cup of tea and a quick sandwich. I've already dropped a call to the consultant. I'm waiting for them to call back. It's back onto Teams, another virtual meeting, a child protection meeting that we take part in if our patients are under a child protection plan or their children are under it. So I'll be about an hour. I've just heard back from the consultant from a visit earlier today, and we've arranged a joint visit to go tomorrow. It's now about 5 to 4. I have to summarise all the visits, make sure I've got a plan in place for everybody, and update any other professionals or family members involved. So that's my day over. It's been busy, it's been varied. I'm just about to get ready to run a tweet chat with RCN NRN, where I volunteer to support other newly registered nurses. It'll be a mad busy hour, but I love doing it and hopefully you guys all get support from that. So follow us at RCN NRN.